Welcome to meeting number 11 of the House of Commons Standing Committee on Procedure and House Affairs. Pursuant to the order of reference of Tuesday, April 11th, the committee is meeting to discuss the parliamentary duties in the context of the COVID-19 pandemic. Before we start, I want to inform the members that pursuant to this order of reference, the committee is meeting for two reasons. It is beneficial to keep this in mind, and I know we have new witnesses from time to time and also different people that may be viewing this video footage. So I wanted to remind everyone that the two reasons we're meeting for is one, for the purpose of undertaking a study and receiving evidence concerning matters related to the conduct of parliamentary duties in the context of COVID-19 pandemic. And number two, to prepare and present a report to the House of Commons by May 15 on the said study. The order of reference also stipulates that only motions needed to determine witnesses and motions related to the adoption of the report are in order. Today's meeting is taking place via video conference, and the proceedings will be made available via the House of Commons website. So you are aware, the webcast will always show the person speaking rather than the entirety of the committee in order to facilitate the work of our interpreters and to ensure an orderly meeting. I would like to outline a few rules to follow. Interpretation in this video conference will work very much like in a regular committee meeting. You have the choice at the bottom of your screen of either floor, English, or French. If you haven't selected a language, I recommend you do so right now. Before speaking, please wait until I recognize you by name. And when you are ready to speak, you can either click on the microphone icon to activate your mic, or you can hold down the space bar while you are speaking. And then when you are done speaking, you can release the spacebar similar to a walkie-talkie. This is very beneficial for quick back and forth responses. A reminder that all comments by members and witnesses should be addressed through the chair. Should members need to request the floor outside of their designated time for questions, they should activate their mic and state that they have a point of order. If a member wishes to intervene on a point of order that has been raised by another member, they should use the raised hand function. This will signal to the chair your interest to speak. In order to do so, you should click on participants. At the bottom of your screen, a list will pop up on the side of your screen with your name, and the raised hand function should either be at the bottom of that list or at the side. You should be able to see if you've been able to click successfully. When speaking, please speak slowly and clearly. When you are not speaking, your mic should always be on mute. This is vitally important for these meetings because any background sound can be very disruptive. The use of headsets is also strongly encouraged. Of course, Mr. Broussard, that's okay. We can still hear you even if you don't have your headset here today. The sound is just a little bit clearer and sharper if you do have one. Should any technical challenges arise, for example, in relation to interpretation, or if you are accidentally disconnected, please advise the chair immediately and the technical team will work to resolve them. Please note that we may need to suspend during these times as we need to ensure that all members are able to participate fully. Before we get started, can everyone click on their screen in the top right-hand corner and ensure they are on gallery view. This view should enable you to see all the participants in a grid view, and it will ensure that all video participants can see one another. This is also the most realistic or mimics what we usually see in a committee meeting, the best we can do virtually. Also, when you are stepping away or looking away for a moment, I do advise that you leave your screen on rather than shutting your video off so that we know you didn't have some kind of a technical problem and you're still there, just as you would in a committee room. During this meeting, we will follow the same rules that usually apply to opening statements and the questioning of witnesses during our regular meetings. Each witness will have 10 minutes for an opening statement, followed by the usual rounds of questions from members. I'd just like to urge the witnesses, if they do have less than 10 minutes, that would be even ideal. If you can shave off a minute or two, that will be very helpful. And I'll definitely remind those witnesses in the second round, especially of this, because there's many questions we want to get to. Just as we usually would in a regular committee meeting, we'll suspend in between panels in order to allow for the first group of witnesses to depart and for the next panel to join. In today's meeting, we may have about a 5 to 10 minute suspension at that time, so the technical team can get set up. I'd like to welcome our witnesses today. We have Monsieur Michel Patrice, Deputy Clerk Administration. We have Monsieur Pierre Perron, the Chief Human Resources Officer, and we have Melanie Leclerc, Director of Employee Relations. We also have from the Public Health Agency of Canada, Dr. Barbara Raymond, Executive Medical Advisor, Vice President's Office, Infectious Disease Prevention and Control Branch. So I'd like to start with Monsieur Michel Patrice, please.
Merci, Madame la Présidente.
Thank you, Madam Chair. I'm here today with Pierre Perron, our Chief Human Resources Officer, who is also leading the House Administration's Crisis Management Team. We've put in place a number of preventative measures to help ensure the health and safety of members, their staff, and administration employees throughout the COVID-19 pandemic. Our actions are guided by information from public health officials at various levels, with whom our health and safety team are in regular communication. Furthermore, we are liaising closely on various matters with parliamentary partners, other legislatures, and security partners in order to base our actions on relevant and up-to-date information. For several weeks now, the administration's crisis management and incident management teams have been meeting regularly to assess the situation, discuss mitigation strategies, and determine how to best support members and ensure a safe and healthy workplace.
Support of members and their staff. We have established a medical advisory service for those experiencing health-related issues that may be linked to COVID-19. Available Monday to Friday, the service arranges medical callback support with an on-call physician. Our in-house occupational health nurse are tracking cases, following up, and responding to any concerns. In addition, 4 virtual sessions were offered by our members' HR services team to provide information to members relating to their role as employers. These complemented the information shared with members on source. Our Employee and Family Assistance Program continues to be available to members, their staff, and administration employees for confidential support 24 hours a day. Mental health support is an ongoing priority, and we want to ensure that everyone in the House of Commons community is aware of the resources that are available to them. For House administration employees, I can assure you that only those whose physical presence is necessary to provide required service are reporting to work on site. All other employees are teleworking where possible. I am proud and impressed by the ingenuity of employees who are finding solutions to continue to provide support and services while in many cases also caring for family members. Where employees are unable to work, we have introduced flexible leave options. Several steps have also been taken to protect those who are on site. We have increased the cleaning of high traffic areas to 3 times a day. This includes entrance, elevators, and handrails. A special COVID-19 cleaning and disinfecting service has been implemented for suspected and confirmed cases. This is in keeping with a protocol that has been established based on advice from public health officials. Additional hand sanitizing stations have been deployed, and sanitizing wipes are made available to frontline personnel. Physical distancing measures and proper hand hygiene reminders have been communicated, and signage is displayed throughout the precinct. Plexiglass barriers have been installed in areas where physical distancing options are not always possible. Other simple but important measures have also been taken, such as the rearrangement of furnitures in lunchrooms. Our health and safety team continues to monitor the situation on site to ensure that guidance is being respected and to answer any employees' questions. Regular communication with staff continue to be a priority, and we are making special effort to stay in touch with those who do not have House of Commons mobile device. As such, we are communicating by text messages, email, desktop pop-up, and public website, and keeping a dial-in information up to date. We use our regular communication to provide updated information, such as the ID guidelines for interprovincial travel and change to the out-sitting calendar, and also to remind all employees of public health recommendations. Our occupational health nurses are personally following up with employees who have shown symptoms and liaising with public health authorities. Through consultation with public health officials, we have been informed that personal protective equipment is not required at this time for employees working on site. However, given recent indication of a possible change of view on the use of masks, this policy will be closely monitored and adjusted as necessary. We have procured masks and gloves and are preparing fact sheets to accompany their distribution if required. Nous sommes convaincus.
We are confident that we are in a strong position to support the activities of the House of Commons at the lowest risk possible to everyone involved. We will continue to closely monitor the evolving situation and adjust our actions accordingly. I can say without reservation that this commitment to ensure a safe workplace is shared by all in the parliamentary community. Members of my team and I myself have been in constant communication with all WHIP's offices, and I am confident that everyone is contributing to the application and respect of the various measures put in place to protect us and mitigate potential risks.
Pleasure to answer any question you may have. Thank you.
Thank you for your statements. Always a pleasure to have you, Mr. Perron, and your team here at PROC, as we've had you here many times before. So thank you for attending. And next up, we have a new witness that we've never had at PROC before, Dr. Raymond. If we can have your opening statement, please.
Hello, Madam Chair and committee members, and thank you for the opportunity to speak to you this morning with respect to the public health issues associated with this particular study. I will start with a brief overview or update on COVID-19 in Canada. As of today, we have more than 38,000 cases of COVID-19 in Canada and over 1,800 deaths reported. More than 1/3 of these cases are in individuals over the age of 60. The virus has proven fatal in 4.5% of these cases. Over 600,000 people have been tested for COVID-19, and approximately 6.5% of those tested have been positive for the virus. It has now been 16 weeks, just over 16 weeks since the first cluster of COVID-19 was identified in China. In Canada, we first identified our first case on January 15th. And we first began to see what we consider community level transmission mid-March, about March 15th. And in Canada, at federal, provincial, and territorial levels, governments have taken extraordinary measures to respond to COVID-19. For example, border measures. Since February 3rd, the Public Health Agency of Canada has enacted a number of emergency orders under the Quarantine Act to minimize risk of exposure to COVID-19 in Canada, to reduce risks from other countries, to repatriate Canadians, and to strengthen measures at our borders to reduce the impact of COVID-19 in Canada. And the result is that the ease of travel that so many of us have taken for granted, mandatory isolation or quarantine periods, and this includes even some travel within Canada from province to province. So this is a really extraordinary switch for us. Physical distancing, one of the most important measures that have been put in place to control the spread of COVID-19. The need for physical distancing has changed the way we live and work and the way we interact with one another. Mass gatherings have now been prohibited, and which has significantly changed the way that we come together in committee meetings, how we celebrate, and how we mourn. The necessity to protect the more vulnerable members of our society has meant that we have we've not been able to see many of our family and friends for many weeks. And that's a real challenge. Schools have been closed, which impacts not only students, but parents and families. And this has required and generated incredible creativity on the part of educators to support ongoing online learning. In terms of our workforce, all but essential frontline workers have been instructed to stay home. Some non-essential workers are able to work from home, but maybe many others aren't. And this is having a very significant impact on individuals and families as well. Impacts on businesses. Many businesses have been closed or have had to significantly modify how they conduct their business, which is having a very significant impact across the board. It is hard to conceive of all of the ways that our lives have changed in such fundamental ways over such a short period. All Canadians have taken extraordinary steps and made extraordinary sacrifices to bring us to the point where we feel we are seeing some signs that the outbreak may be slowing, at least in some parts of the country. Although the data to be reported in coming days and weeks will continue to be critical in determining our trajectory, the rate of doubling of reported cases in Canada has slowed from doubling every 3 to 4 days in the period of March 12th to 28th to doubling approximately every 5 to 8 days in the period March 29th to April 10th. And we are all anxious to have life return to normal. And it is natural that any signs of the outbreak ebbing will give us hope for that return to normal. Unfortunately, we are still in a pandemic situation and we must remain vigilant. How we move forward will be critical. In the same manner that we increased our public health interventions over time, we will have to ease those interventions very carefully over time and in a phased approach if we want to avoid a rebound effect of this outbreak. The Public Health Agency of Canada is working with provincial and territorial governments to determine the safest ways to resume many of our previously routine activities. In the meantime, we must stay the course. At this point in time, the best advice of the Public Health Agency to Canadians remains: stay at home as much as possible. Most importantly, if you feel ill, practice physical distancing, practice good hand hygiene, practice good respiratory etiquette, such as covering your mouth and nose with your arm or sleeve when coughing, and sneezing, disposing of used Kleenex as soon as possible, and doing all you can to protect others, particularly the most vulnerable in our society from infection. So thank you. Happy to hear your questions.
Thank you, Dr. Raymond. Thank you to all of our witnesses. We know this is a very busy time for you, and I definitely acknowledge the sentiment that grieving is very difficult at this time, and our hearts go out to all those that have lost loved ones in the Nova Scotia mass shooting. It's a very tragic incident, and I know that Canadians are all grieving in their own ways at this time for those that have lost loved ones. So now we will start with the first round of questioning, which is 6 minutes. Mr. Broussard, please.
Thank you, Madam Chair. I'm going to get right into it because time is short and I do have a lot of questions. I'll start with Dr. Raymond. Dr. Raymond, there's been 3 sessions of Parliament that have been held so far. The Prime Minister holds daily briefings, followed by daily briefings in West Block by ministers. And some deputies. In fact, the Chief Medical Officer of Health is involved in those, and we appreciate the fact that Canadians are getting those daily briefings. Are they in full compliance with public health guidelines as it relates to physical distancing and other measures?
To the best of my understanding, yes, they are. It is certainly what is the intent. So every effort has been made to ensure that those briefings are aligned with our best advice.
Okay, so just to confirm that they are aligned with the best advice, that's great. Are these also, Dr. Raymond, by and large, the same safeguards observed in essential businesses that are open across the country?
The same advice is provided. The same advice applies across the board for all Canadians, all settings, more or less. However, how they are implemented in different settings may vary somewhat. So what may be achievable in one setting may not be achievable in another. So you may have alternate measures that reinforce or compensate for something that can't be done. So for example, in a work setting where you cannot maintain a 2-meter distance, reliably, consistently maintain a 2-meter distance, and it is an essential workplace, there may be a requirement for personal protective equipment in those circumstances. But it really is a case-by-case analysis of each workplace and its peculiarities, its ability to implement the public health measures.
Thank you, Dr. Raymond. I want to move now to Mr. Patrice, particularly as it relates to West Block. How many staff are required for these daily briefings by the ministers on a daily basis?
I will have to get you back the specific information for those daily briefing, but I understand the support for those daily briefing would be minimal. But I'll back to the committee for the exact numbers.
I also understand, Mr. Patrice, that anybody entering West Block has to sign in, whether it's for these briefings or any other business of West Block. Do we know specifically how many people are signing into West Block on a daily basis?
We have that information and we'll be happy to provide the committee such information.
Thank you. And this would go to both of you, Mr. Patrice and Dr. Raymond. The committee is charged with looking at non-virtual alternatives. And the other day we had Mr. Dufresne come in to testify on the legal and constitutional aspects of a virtual parliament. He referred specifically to Section 16 of the Constitution that Ottawa is the seat of government. And that there's no legal impediment on holding meetings outside of Parliament, for example, the 1916 fire. There are other venues within Ottawa. For example, the Canadian Tire Centre has 17,373 seats. The Shaw Centre 365,000 square feet. TD Place, just down the road from Parliament Hill, has 10,575 seats. As an alternative, and again, nobody's talking about 338 members coming back to Parliament, but if and when we do return to some sense of normalcy, and there is a requirement still for physical distancing, would those or could those be alternatives, those venues that we can look at? Because, for example, at the Shaw Centre, the diameter apart from each member of Parliament, assuming 338, would be 2,164 feet apart. And the same would apply in the Canadian Tire Centre with 80 sections of seats. So could those venues be used as an alternative to sitting in the actual chamber? Mr. Patrice first.
I must admit that it's quite interesting, and if it's the will of the House, definitely we would look at making it possible.
Now, Dr. Raymond, would that meet, in those scenarios, would that meet the physical distancing requirement other than holding a virtual parliament where an in-presence parliament would be required? Would those type of venues, given the fact that they also have audio-visual equipment, screens, so they could accommodate, but simply from a health standpoint, would that accommodate some of the physical distancing guidelines that Health Canada would call for?
Well, it certainly sounds as though you would definitely be able to meet and surpass your physical distancing requirement. However, I would caution that changing your venue, you have to take a more holistic approach to that. It's not just a matter of spacing everybody out. You're asking then people to work in an unfamiliar environment. What will it take to sustain that environment in terms of cleaning, disinfection, control of who's coming and going, materials at hand. Introducing capacity for hand washing, all of those different things. So
those measures could be met.
Thank you, Dr. Raymond. We'll now continue on to Mr. Gerritsen. Oh, sorry, no, Dr. Duncan, please.
Your mute's on.
Dr. Kirsty Duncan, you're mute. Yes.
Thank you. Good morning, dear colleagues. Thank you to all our witnesses. And Dr. Raymond, my questions will be for you. Thank you for everything you're doing to protect the health and safety of Canadians. I have many questions, so I'm looking for short answers, most often just yes or no. First of all, do we see a complete picture in terms of number of cases? Or is there a 1 to 2 week delay between when people get sick and their information is reported to the Public Health Agency of Canada? Is there a delay, yes or no?
There is always an intrinsic delay from the time of.
Yes. So yes, thank you. Has the goal of the last many weeks been to flatten the curve and increase healthcare capacity? Yes or no?
You bet.
Thank you. The month spent under strong public health measures such as physical distancing has, quote, prevented an explosive outbreak in Canada. However, I believe that the Chief Public Health Officer has been clear that we are not yet out of the woods. Are we out of the woods yet? Yes or no?
We are not out of the woods.
Thank you. If each infected Canadian transmits COVID to less than one person, is it true the epidemic in Canada will fade out, will die out? Yes or no?
An epidemic wave will die out, but bearing in mind that another epidemic wave could follow if those conditions weren't maintained.
Thank you so much. In Canada, are we at less than one yet?
No.
Are not. Thank you. How many cases did Ontario add yesterday, please?
Oh, I don't have that number in front of me, but I can get it for you. But
thank you.
They are continuing to accrue cases.
Thank you. And how many, and I could ask that you would then table the number for how many cases Quebec added yesterday, please?
Yes,
Is
absolutely.
Thank you so much. And thank you for being so kind with my rapid questions. Is asymptomatic spread of COVID-19 possible, yes or no?
Yes, it is possible. We do not know the degree to which it is driving the epidemic, but we do believe it to be possible. In particular, in addition to that pre-symptomatic spread, people who are infectious before they are aware that they are ill is also a significant concern.
Thank you, Dr. Raymond. That was my next question. In watching the press conference each day, I believe that Canada has a series of regional epidemics. Which province are continuing to accrue cases? Could you simply name those provinces, please?
British Columbia, Quebec, Ontario. We're still seeing Alberta. Yeah, we're still continuing to see cases in a number of our larger provinces.
Thank you. What is the doubling rate right now in Canada, please?
I believe the doubling rate was cited to me as 5 to 8 days currently.
So every 5 to 8 days, the cases will double. Thank you.
Yes.
What does that mean for infections in terms of cases in the next few weeks, please?
Well, it means that we anticipate that we will continue to see a considerable number of cases over the coming weeks.
Thank you, Dr. Raymond. And what will that mean in terms of the number of deaths?
Unfortunately, it will similarly increase.
Thank you for all your work you are doing. What happens if we return to the way things were before COVID-19 too early, please?
Frankly, I'm not sure that there is a return to the way things were pre-COVID-19. Any return that we make to normal is going to be a new normal. If we rush that return, we risk a rebound, and we risk losing the gains that we have made, that all Canadians have sacrificed significantly for over the last number of weeks. And that would be tragic.
And I'll just finish with, what is the Public Health Agency of Canada's view on reconvening Parliament too early, please? And thank you for your work.
Mm-hmm. Public Health Agency of Canada does not have a specific view on reconvening Parliament early, but we, as indicated, our advice to all Canadians is to stay the course, to maintain physical distancing, to continue to protect those who are more vulnerable, practice very good, robust public health measures, and if you must, if people have to work, go to work, to do so in the safest way possible.
Thank you, Dr. Raymond. We'll next go on to Mademoiselle Normandie.
Thank you very much, Madam Chair. Hello to everyone, and thank you to our witnesses. I'd like to begin with Dr. Raymond on some clarification about this 14 days of isolation when you go from one province to another. There seems to be a little bit of variability in this. So my first question is whether or not that applies to members of Parliament.
I'm thinking about the provincial orders that I have seen most recently. I have not seen I've not seen a specific exemption for members of Parliament, although there are exemptions made for individuals who are determined to be essential workers. I am not sure how members of Parliament fall into that categorization.
Advenant que
And so if members of Parliament have to isolate for 14 days, can you tell me what that implies? What are the criteria then that have to be respected? For example, can we do groceries? Do we have to stay at home? What exactly does that isolation involve?
Mm-hmm. So isolation or self-isolation, quarantining essentially is to stay at home. You remain at home. You do not go out. Someone else supports you in terms of groceries and all of the rest. So you remain at home unless there is some need to seek medical attention or something similar. And you remain in your home, separated from others who may be in the home as much as possible. You adopt rigorous cleaning, disinfection type protocols, and self-monitor closely. And if you develop symptoms, you identify to public health immediately. For some individuals who have been designated as essential workers, there are exemptions to the quarantine where they are permitted to leave the home, to go to work and to return to the home, but are expected to maintain the quarantine otherwise.
J'aimerais savoir.
Thank you. One can expect that slowly but surely, things like daycares and schools will open up over the months. Some provinces have begun speaking about this already. In your opinion, would that pose a greater risk then for members of Parliament who have children if they were to come back to the house where it recalled?
Interesting question. I think all of the provinces and territories now, we are very actively engaged in these conversations about how to reintroduce what we once thought of as normal activities back into our experience. No action stands alone. So determining that someone is to go back to work is associated with someone having to arrange childcare, that sort of thing. It's associated with an entire workplace having to gear up and take on appropriate preparedness and response activities. Nothing happens in isolation. So each of these measures has a fan-out effect. Clearly, resuming these measures, easing up, causes us to have concern that we will see a resurgence of cases. And we should be prepared that as we ease back into more our previous, something resembling our previous patterns of behavior, that if we see resurgence of cases, that we will have to respond very rapidly in order to re-contain things. So we may be seeing a situation where we ease up and release some of the restrictions on different aspects of life, return to work or childcare or school, but we should also be very prepared to see those be restricted again if we see resurgence of cases.
Est-ce que vous pourriez...
Could you tell me if currently there is a plan, a backup plan? For example, if there's an MP or staff that does get COVID, what is the plan?
The Public Health Agency of Canada would not be involved in a particular plan for an individual workplace. So I would suggest that perhaps your administrative individual could probably answer that for you. It sounds as though they have put some plans in place, but it would not be the purview of the Public Health Agency of Canada.
Thank you, Dr. Raymond. Next, can we have Ms. Blaney, please?
Hello, everybody, and thank you both for those very important presentations. I guess, first of all, I just want to say that I was able to sit in the first smaller parliament, and part of the reason as a British Columbian I was able to sit there was I stayed, and then when I came home back to BC, I self-quarantined with my family for 2 weeks. So, you know, I arrived home and my family wasn't there because they had gone to get my son that was away in university. They drove him back instead of having him fly, just trying to keep him safe. And then we stayed in the home. Family members and friends brought us food. It was very weird, but we did that because we knew that things were happening, and I certainly did not want to be unintentionally infecting anyone in my constituency and in my riding. So we did that as a decision. I'm also hearing from constituents in my riding that are health professionals, nurses, doctors, caregivers who are now living in their RVs and self-isolating from their families. It's heartbreaking to hear stories from some of those health professionals who are talking about looking over the fence and watching their kids play, but not being able to hug them. So people are taking some really massive decisions to make sure that they take care of the health and well-being of their community and their family. So I just want to, I guess, first of all, just talk about the fact that, you know, Mr. Broussard brought up the idea of having a venue that provides spacing for members of parliament. So my questions around that are, what about the workers? You know, are there, I mean, the amount of work to prepare. So I guess, you know, first of all, what about the workers? How is morale for all of the workers in the House of Commons who are having to come in and work with Parliament? You know, you have 32 parliamentarians, but how many staff does that require to look after? The amount of cleaning, you know, there was discussion about how often you're cleaning in those high areas. So when the House is actually sitting for the day, or in our case, overnight, how much more cleaning is happening? What does that look like? And if you looked at some of these spaces, is there appropriate spaces? Like, I think it'd be amazing, and that makes me remember to slow down, interpreters who are doing so much work in a very unusual environment, for them to be able to do their work effectively. There's so many challenges. I don't know if those spaces would provide it. So I'm just wondering, and I guess I'm opening it up to both of you to answer in your expertise, just about, you know, and the other factor of having 338 parliamentarians spaced out nicely over those spaces, but flying, like, for me to fly to Ottawa it's an epic journey. I'm on Vancouver Island, and at this point actually can't fly from my riding. I would have to drive a substantial way to actually get on a plane. So that's half of my time already. But if you could just talk about some of those challenges, I would really appreciate it so that we all have clarity. Mr. Patrice, that would be amazing.
Okay.
Thank you for your question. I'm going to start by saying that your administration is an amazing and committed staff. So the morale, I'm going to say, is good. People, I'm going to also disclose, are working very hard and long hours, but we're proud to support the House of Commons and members of Parliament. In terms of numbers to support the House when it's sitting, I'm going to say when it's not sitting right now in the current situation, we have about, in terms of all our facilities and over the precinct, about 135 staff that is on site, but we have many facilities, and that does not obviously count the protective service person. For sittings, such as the one that we did last Saturday, you can add another 55 people. So roughly 190 people when the house is sitting in those extraordinary times. A lot of our staff are working from home or supporting from home. So I would say that, and we're happy that we provide the services, but we also always looking for feedback in areas where we could do better or better support you. Thank you.
And so, Dr. Raymond, could you speak to the part about asking parliamentarians, 338 of us, to fly across the country to come to a place where we may have appropriate social distance, and what some of the barriers would be potentially around having all of the staff required to host us? You have to unmute. You're still, thank you.
There. In terms of answering that question, I think I would probably give you the same advice that I have given a number of different businesses, which is that there needs to be a fairly thorough risk assessment done that looks at all aspects of the equation. As you say, it's not simply a matter of bringing the core group back together. There are the ripple effects. So there's the associated staff, and then there's the support, and then there's the environmental cleaning and so forth, and then there's the air travel and the going back and forth and impact on families at home, or whether people are going to stay here in Ottawa. For all of those groups of people, you have to think about what are their risks. What are their risks of being exposed to the COVID-19 virus? How many people do they come into contact with in a day? Are they someone who will encounter a large number of people? Are they individuals who may be in settings where they may be more likely to come into contact?
Thank you, Dr. Raymond. That's all the time we have. We're going to continue into our second round. 5 minutes for Mr. Eric Duncan, please.
Good morning, everybody, and thank you for the opportunity. I want to build on Mr. Broussard's comments and Dr. Duncan from before, and maybe vent a little bit. I have the utmost respect, as you know, for all of my colleagues here in the discussions and that have gone around in the line of questioning, but I just want to speak about some of where I feel a misleading perception of where some members are advocating. We keep talking about a return to normal and the fear or what the consequences would be of a return to normal. And respectfully, from what I've seen over the course of the last several days of us having conversations about non-virtual or different options, I don't think there's anybody here on this committee or many parliamentarians that are advocating for a full return of 338 members into the chamber and all of the staff and support staff there. Some questions were asked about the number of people on a normal working day, and I agree with what Dr. Raymond had said, is that the new normal is going to be different than the normal we had before, and I certainly agree with that. But I fear that there's a perception out there from perhaps members of Canadians who are listening to this that are thinking that there's not physical distancing, or we're jeopardizing the health of each other by perhaps meeting in some ratio form continually in West Block. I believe Miss Blaney was one. I waved to her from the gallery on the first emergency sitting, and Mr. Gerritsen was there as well. And I was a backup member, but got to kind of see it firsthand. And I have to say that the House of Commons administration had did an excellent job when it came to our safety from a health perspective. The physical distancing was, I think, very well done. I noted Miss May at one point, which I respect, had said about the opposition lobbies and some of the walking there, but I think other entities.
We can just, oh, Mr. Duncan, can you hear us right now? Mr. Duncan, I'll pause your time, of course, while this technical difficulty is happening. Hi.
hopefully he knows that he has frozen up.
I think he might know. Oh, no, he doesn't seem to know.
I'm back here now.
Okay, sorry. So we just paused for a moment just so that you wouldn't lose your time. And we're just going to, of course, start from where we left off before we could hear you. So please continue.
Thank you. And I'll mention that I'm going to talk to the industry committee about better rural internet service when this is all done. Just to build on the point again of what I was saying there about the interpreters, if I was caught on that aspect there and some of the challenges there, they're in the building already. Security are there, and there is the presence there. I just will make this comment constructively that over the course of the last month or so, the Prime Minister's made announcements every day, and that's important for Canadians, and not begrudging that in an in-person level. And then ministers have followed up in West Block on a near daily basis, giving Canadians information that they want to know in these challenging times. And I respect that. And again, there's a role and a necessity for Canadians to hear the news from the government. But also in that same building, there's an opportunity for all of us, with your members of the government or opposition, to ask questions and give the feedback of what we're hearing from constituents on a daily basis. The news, if a media conference can be done, that requires interpretation, that requires technical support, that requires the security, that requires the cleaning process. If that is being done 7 days a week, no problem in the West Block, I think with physical distancing, proper health and safety protocols like have been done, it is not unreasonable to continue to have this ratioed, safe number of members that can most continue to work from home like myself, but have some presence. Like the ministers are in Ottawa and likely not traveling back and forth. We can have some team members that are there and that are doing that. So I just, at the end of the day, I want people to understand that I think when we have these conversations, I have the utmost respect for Dr. Raymond and public health officials and our House of Commons administration. We're not advocating for 338 people to come back. The pages don't have to be there. Our staff don't have to be there. We can have these ratioed numbers. And I will just make the argument, perhaps in closing a little bit, that if it's safe for ministers to do press conferences in the West Block at a ratioed level, combining a physical presence and a technological virtual presence, surely to heavens, as parliamentarians, we can do the same as a fundamental part. And we can balance those aspects of not having to travel back and forth into our ridings or doing them for extended periods of time. Where there's a will, there's a way to do it safely. And I will just say, I've actually been very proud of the 3 in-person sessions. I wish when we get back to normal, when we do, I hope the House of Commons in question period looks more like the 3 that we've had during this time, of constructive questions, sometimes tough questions, but constructive questions and proposals. And I actually think at the end of the day, because of that presence in the chamber, because of those questions and the ability for all members to share what they're hearing in their ridings, we're actually getting better government policy at the end of the day. We've seen changes on the business wage subsidy. We've seen changes in CERB, and that has benefited Canadians. So I just want to wrap up my comments just by saying more of a rant and maybe giving Dr. Raymond and our House administration time to breathe themselves, that there is no member, I believe, that is not acting in good faith, that is not wanting to have health and safety measures as it is coming to Ottawa, protecting ourselves while here, being within the West Block. And I think there's a balance there, again, when I go back of what's being done with media conferences and some of the other features of what's already happening, the staff that are already there, we can do a form of that there safely. And I just want to make sure that that presence and that perception of what Canadians think some of us may be advocating for is in no way unsafe. And the 3 sessions we've already had are perfect, excellent models that could be tweaked, I'm sure, here or there to make it even better, but are a safe and good way of doing it. And again, we can add some virtual aspects, some other non-virtual aspects.
We're almost done for time, Mr. Duncan. I'll give a little, about 30 seconds for an answer, please.
Not sure if anybody wants to take that or not. There wasn't really a question in there, but
30 seconds if anyone would like to make a comment based off of those comments. All right, then, seeing as there's none, we'll move on to Ms. Pettipas-Taylor, please. Please unmute your mic.
Sorry
Okay,
about that.
No problem. Your time will start now.
I, first of all, would like to take an opportunity to thank the House administration staff for all of the work that you've been doing over the past month or so to support us during these very difficult times. And I also wanted to take a moment to thank the public health officials for your leadership that you've shown, that you continue to show, and we just truly appreciate the work that you do. On March 13th, we had 197 confirmed or presumptive cases of COVID-19 in this country, 197. The Board of Internal Economy at that time took preventative measures to protect the health and safety of staff, of MPs, and even members of the public by putting some restrictions in place. Today in Canada, when I look at the numbers on the public health site, we have 40,824 cases of COVID-19 in Canada. I'm going to repeat that number, 40,824. So my question is, do we think that it's wise at this time to loosen the measures that we've imposed just over a month ago on the parliamentary precinct?
I think this question is probably for Dr. Raymond. Is that correct?
Either Dr. Raymond or even the House administration staff, both actually.
Okay, if you could both quickly maybe answer to that.
I would say that that our advice has been consistently to stay the course and to continue. We have asked Canadians to make very extraordinary sacrifices in order to see some flattening of the curve that we are seeing. And our advice to all Canadians is to stay the course. If there is a determination that it is necessary to return to a workplace, we would recommend that a very careful risk assessment is undertaken and all of those risks are addressed, and that there is a plan in place to rapidly reintroduce measures should further cases be identified.
Mr. Perron, Patrice, Mr.
Yes.
Patrice.
Yes. Well, based on the recommendation of public health official and actually the decision of the board in terms of the directions to follow, we're continuing to the measures that were approved on March 13. The board recently reconfirmed those measures.
Thank you. As members of Parliament, we are all employers, we all have employees, and I'm wondering, then this question would be directed to Monsieur Perron or to Monsieur Patrice, what are the obligations employers have towards their employees during the type of a pandemic situation that we're facing right now?
I'm just going to start in saying that our obligation as employers is to provide a safe and secure health environment. So maybe I could ask Mr. Perron or Madame Leclerc to continue and respond in terms of the different protocol that we've put in place. Thank you.
And if I may, Michelle kind of stole my answer there, but members are employers for their employees, so it's important to ensure that you are providing your employees with a safe environment. I know that in Ottawa it's probably easier, but I know that in your ridings there's probably more activity. We have an HR service for members that are ready to assist you. If you have questions about how to manage your workplaces, please do call us. Even though they are working from home, they are able to support you wherever you are in Canada.
Thank you. And I believe that Ms. May wanted to ask a question. So, Madam Chair, I don't know how much time I have left.
You have about 30 seconds, 40 seconds.
So I'll share my time with Madam May, if that's okay.
Thank you. If I can, Madam Chair, I'll ask a question within 30 seconds. Monsieur Patrice, Observing from CPAC the session that just took place, I didn't see 6 feet distance between the table officers. I'm concerned that we didn't observe physical distancing when I couldn't, in the opposition lobby, I observed MPs clustering. The issue isn't whether I could walk in. The issue is I observed MPs clustering, and I'm very concerned for our table officers.
Okay, I think that's all the time we have. Maybe at the end of this round, we can ask if the committee is okay with hearing from Ms. May a little bit more. Next, we will move on to Mr. Richards, please. 5 minutes.
Thank you. Obviously we have to consider public health when we think about how we do everything that we do, and as parliamentarians, obviously we're contemplating now how we continue to perform our roles as representatives of the people, and what that means for how the House of Commons sits, how our committees work, how we do all of our other functions, whether they be in our riding or our political functions. I know, for example, myself, I had planned to spend a lot of time, as I quite often do in my riding in non-election periods, getting out to people's doors and knocking on their doors to hear from them what kind of concerns they have, what things they'd like to see me working on their behalf in Parliament and elsewhere. And obviously through the last 6 weeks or so, that has not been something that I've been able to do, and it would have typically been something I would have done quite a bit of through a couple of non-sitting weeks and things like that. And it's obviously affects a lot of the things we do. One of the other functions that we all perform, of course, as politicians, is we have our political functions, and that I guess would be part of that. So I'm curious, obviously we're in a minority parliament right now. Dr. Raymond, I wonder if you could tell us, elections are always possible, of course, in a minority parliament at just about any time. I wonder if you could just tell us, what would that look like if there was to be an election, this summer or this fall, given what we're dealing with this crisis? How do you think it would be possible for that to occur in the next, 3, 4, 5 months, and if so, what would have to be done to take precautions to enable something like that to occur?
So if something of that nature were required, it would require a significant degree of planning in terms of how to do that safely. Physical distancing, avoiding mass gatherings, so avoiding a large number of people coming together at any given time. If the requirement is absolute, then we find a way to manage the risk associated with it. The first rule of risk management is, if you can, avoid or eliminate the risk. If you can't avoid or eliminate the risk, then you take measures to put infrastructure or other structural changes into place that will help manage or decrease the risk. And then you introduce policies and practices and so forth that will help to further reduce the risk. But you really always have to be aware that you are running a risk and be willing to manage that.
So then, obviously there's factors that anyone would consider in terms of triggering an election, and many of those are political. But obviously we're seeking, I'm asking for your advice from a health perspective, purely from a health perspective, of course. Would you say it would be inadvisable it would be advisable to attempt to do everything we can to avoid going into an election during this period of time?
I would I would recommend taking whatever measures we could to avoid creating a condition where we increase the risk of transmission, where we create an opportunity for mass gatherings or large gatherings, where we create an opportunity or an obligation for people to gather together where they possibly can't maintain their distancing. Also, there's some people are sick or some people are symptomatic, won't be able to leave their homes. It would be a very complex undertaking.
Yeah, and certainly to hear you talk about the idea of large gatherings. I mean, I guess the idea of people going to the polling stations to vote. I mean, it's not necessarily a large gathering all at once, but you've obviously got a lot of people going in and out of the same space over the course of a day. It would be pretty hard to imagine a scenario where that would be possible to do safely, I would think.
It would be challenging. It would be challenging. And my station always has a big lineup. So
Thank you. Thank you so much. Next, we will move on to Mr. Turnbull for 5 minutes.
My apologies there.
No
I
problem.
lost my mute button. Thank you very much. I really hold all of our panelists in very high regard, and I thank you for being here. I'm going to jump right into questions in view of time. My first question is directed towards Dr. Raymond. I want to ask about the public health advice and how decisions are made before things like stay at home, like messages are released to the public. So, so before PHAC came out with that messaging, did public health officials consider the inconvenience that it would cause in people's daily lives for them to stay home?
Absolutely.
Great. And did they also consider whether people were technologically savvy and could potentially work remotely?
Yes. Yes, it was considered, and it's always a factor, but we were well aware that not everybody had that capacity.
Okay, thank you. And then what about the knowledge of different internet speeds and the variation in that across the country? Was that taken into consideration before that public health advice was put out very broadly?
It was part of the knowledge set that we had at the time. I guess I would say to you that if we could choose the time for our pandemic, we would have chosen a time when conditions maybe were better suited to having everybody stay at home.
Sure, got it. But what about the disruption to the economy and workplaces having been people not being able to go to work? Was that taken into consideration?
These decisions were not taken lightly, were not taken easily. There was a very full appreciation of just the level of sacrifices that Canadians were being asked to make to preserve the health and well-being of other Canadians.
So despite all of those inconveniences and disruptions and behavioral shifts that we know are challenging for anybody to accept, public health still came out with the advice to stay home. Now, why did they do that?
Because the cost in terms of human life and illness was considered to warrant it.
Thank you. And does it, in fact, is it fair to ask people to do that when there are massive repercussions associated with not complying with that advice?
That is a very philosophical question. It's a very challenging question. But the nature of public health interventions are that we ask all Canadians to make personal sacrifices, not necessarily for themselves, and sometimes counter to their own best interest or self-interest, but to preserve the health and well-being of others, particularly vulnerable, and in this instance, our elderly and so forth.
Thank you. Thank you. And does that include members of parliament?
We have asked extraordinary things of all Canadians.
Thank you. And I appreciate the answers. We've also heard that many staff, even within the reduced sittings, have to go back to Parliament. And it sounds to me like there's quite a few risks, even within the reduced number. I think the estimates were, by my rudimentary calculations, at least over 100 people are still going back into the physical space. I wonder if, Doctor, I could ask you a question that may make you feel a little bit uncomfortable, but I feel the need to make the point, which is that if you had the medical histories of all the 100 or so people that are having to go back to Parliament, would you in fact be able to predict which ones would contract the virus and or which ones might succumb to it and eventually die?
So I would not necessarily be able to predict who might be in contact or who might be infected, but there are some indicators that we have that we know of who would be the most severely impacted, who would have the most serious disease, who might require a ventilator, critical care, and certainly those who might pass away.
Thank you, Dr. Raymond. That's all the time we have for this round. We are able to, because we have enough time, go into our agreed upon 2.5-minute rounds. And I was just wondering at this time whether, because we do have a couple more minutes of leeway, if we could allow Ms. May to also get in 2.5 minutes as well. Is that okay with the committee? And we will still have enough time to change over to the panelists and get to the next panel. So right now, if I could hear for 2.5 minutes from Mademoiselle Normandin.
Merci beaucoup. J'aurais un petit préambule.
Thank you. I have a short preamble to my question, and I'm only asking one question, so maybe I can give time to others. So I think members can all agree that when it's not necessary, we have to work at home as much as possible. Now, the question regarding our presence in the house is, what's essential? Is it to only go when there are votes? Is it essential to go once a week? Is it essential to go 3 times a week? Is it essential to be 30 MPs, 60 MPs, 120 MPs? So, my question is for Dr. Raymond. Could you give us conditions that are used to decide what is essential and what is not essential in other environments? Conditions, for example, for public safety or public health.
So in general, we have defined essential workers or occupations as people who are providing direct care to those who are impacted by COVID-19 and supporting that care, people who are supporting the response by maintaining food supply, critical infrastructure services, and so forth, and in general, maintaining the ongoing functioning of the country.
Donc, et sous question, pour la présence de ces gens-là, qu'est-ce qui est considéré comme essentiel pour la présence physique?
I don't think we had interpretation there.
Apologies.
Actual physical presence in the workplace. And that is very subjective and could be determined based on the requirements that need to be met in the workplace.
Je comprends que mon temps.
I understand that my time is up, Madam Chair.
So much. We'll move on to Ms. Blaney for 2.5 minutes, please.
Thank you, Madam Chair. I'm just wondering two things. First of all, Mr. Patrice, you talked about having masks and gloves and working out a protocol around that and if they'll be needed. So I'm just wondering, when will this be something that you feel the staff of the House will require? What's the measuring that you'll be using?
Essentially, the advice provided by public health official, we're just trying to anticipate whether this will come and not and be ready.
Thank you. So one of the other questions that I have is, you know, when the House has one of the reduced sittings, and it's had 3 now, I'm just wondering, what does that mean in terms of increased cleaning requirements? And do you have a plan around how to keep all of those spaces, which I talked about earlier, those high travel areas? How is that increased, and are there other areas that you add to the cleaning regime during the reduced sittings?
We've basically planned our work around those requirements in terms of increased cleaning, and we're able to support that requirement.
Okay, and so when you have a reduced sitting of the House, then staff that do that work are encouraged to do a little bit more? Do you have to bring in more people? Just curious, with even in the reduced sittings, how many more people you're actually having to bring on site?
Yeah, in terms of, I've got the specific number for the cleaning staff, but obviously when it's sitting, we bring a bit more cleaning staff. You'll understand that in a no COVID time, our staff is way bigger in terms of supporting the precinct as a whole. So we've got lots of cleaning staff that obviously cannot work from home. Right. That are at home right now. So we do rotation in terms of to put the same pressure on the same people.
So there was a question about sign-in to West Block, and what I understand is every building of Parliament has a sign-in system right now so that we're able to track who's coming in and who's sticking around. And I'm just wondering again around cleaning, if somebody comes in and works from their office within any of the parliamentary buildings, what increase of cleaning is required, and how do you measure that, knowing that people can come in and out of those buildings as they feel they need to during any parliamentary day or any day at all?
Very quickly, in 10 seconds, please.
Yes, the signing for us is very useful because it allows us to do targeted cleaning as opposed to cleaning the old building.
Okay, thank you so much. Ms. May for 2.5 minutes.
Thank you very, very much to all members of the committee. Mr. Patrice, do you remember what I was asking when we ran out of time, and could you respond to the question about physical distancing for table officers and others?
Yes, and in relation to the table officers, you will have noticed that we've moved table officers further down the table. So in terms of the spacing between them, it exceeds the 2 meters. I think you were probably also commenting in terms of when people move around. So, and that I'm going to say, and it's true for me too, is like we all have to adjust and be aware. So it's always a question of self-awareness of where we're located towards another person. Yeah. So we remind our people quite often, and we remind ourselves also.
Yeah, it is the case, of course, that meeting even in the scaled down numbers in which we have been meeting March 24th, April 11th, that it is every time is a risk. And I certainly feel Rachel Blaney is paying on this point because I just booked my travel to get to Ottawa for next week for the Wednesday sitting. And normally I could travel it in one day. It's a day and a half trip involving driving to Vancouver and taking the ferry in order to make the plane. So there's going to be additional risks for MPs to travel during a pandemic. But the point around actual physical distancing in the House, I worried yesterday, or I guess it was Monday, pieces of paper are physically handed to the Speaker. Clearly, we're not keeping physical distancing at all time, and people aren't wearing masks in the chamber. When we lose physical distancing, should we be wearing masks in the chamber?
believe that would be Dr. Raymond. So.
Yes.
Oh, okay.
So our public health advice is if you are unable to consistently maintain a 2-meter distance with between individuals, that we would recommend the wearing of a non-medical mask or a face covering. And that is a measure that protects others. So it's more a measure that contains respiratory droplets and prevents their spread, rather than protects the wearer of the mask. But it is an additional measure that can be taken if you are unable to maintain appropriate physical distancing.
Thank you. That's all the time we have. And I just want to thank the whole committee for their consideration and allowing Ms. May to ask her questions. You've definitely been very dedicated to stick around for all of the meetings that we've had. And we thank you for joining us. And now we will take a 10-minute break so that we can change the panel around. If I could ask for you, I guess it's 8 minutes. Hopefully we'll have everything up and going in 8 minutes. If you can all be back, this is just a suspension. And we'll all be back at 12:30, please. Thank you.
Thank you.
be unfair to anybody. I know that these meetings are going longer than usual. Mr. Richards, Mr. Duncan, are you there? Okay,
Hi, I'm here.
perfect. Okay, perfect. All right. Mr. Duncan, are you there? Mr. Garrettson? If you can turn your cameras on. Okay, seeing as it's 12:31 and we have a very jam-packed panel, I'd like to resume as quickly as possible. So hopefully Mr. Duncan and Mr. Garrettson are close by and can at least hear. Welcome back. We're going to get started. So everyone, I just want to remind you to please click on your screen at the top right-hand corner and ensure that you're in gallery view. This view, I think, is best so that we can all see each other at the same time. For those of you that are joining us, before speaking, please wait until I recognize you by name. When you are ready to speak, you can either click on the microphone icon to activate your mic. It'll be in your picture box on the upper right-hand side. Or you can hold down the space bar while you are speaking. This is kind of the effect of a walkie-talkie. You can click down, hold down the whole time you're speaking, and then release the space button when you're done speaking. This is for our new witnesses that may not have used Zoom before, but I'm sure some of you are probably familiar. A reminder that all comments are to be addressed through the chair. When speaking, please speak slowly and clearly. When you are not speaking, your mic should be on mute. Everyone has actually done a very excellent job on this portion of it, I think, in the last few meetings, but it's the unmute that we sometimes seem to forget. So let's keep that in mind. And please, headsets are strongly encouraged. So I'd like to welcome all of our witnesses to our 11th meeting of PROC. We are very honored to have you all here. You have great expertise that you'll be able to share with us. Today on the second panel of our 11th meeting, we have Monsieur Marc Bosque, the former acting clerk of the House of Commons. We have Emmett McFarlane, Associate Professor, University of Waterloo. We have the Honorable Peter Milliken, former Speaker of the House of Commons. Welcome again. And we have Monsieur Benoit Pelletier, Professor, Faculty of Law at the University of Ottawa. And last but not least, we have Mr. Gregory Tardy, Executive Director of the Institute of Parliamentary and Political Law. Welcome to all of the witnesses. You each have some time allotted. I believe 10 minutes is what you were informed. I'm hoping that some of you will be able to help us out and try to shave off 1 to 2 minutes from that 10-minute introductory comments. Please, if possible, try to do that. So we will start with Mr. Bosque.
For you today, c'est un honneur d'être.
It is an honor to be asked to contribute to your work.
It's rare that the House of Commons and its committees are confronted with existential issues such as those with which they are seized today. Hence the need to step back and reflect on the broad principles you will need to consider in formulating your recommendations. The Speaker has outlined a series of such principles. The committee should heed these as they are important reality checks on the practical implications of experimenting with the concept of a virtual House of Commons. I would add one overarching principle: the need to have an active and functioning legislative branch of government during a time of crisis. In too many countries around the world, dominant executive branches of government eclipse parliaments. This makes parliaments weaker and less relevant. That imbalance needs to be addressed, especially in a time of crisis. The House of Commons needs to be functioning and to be seen to be functioning. Je veux être clair. Le Parlement.
To be clear, Parliament, and in particular the House of Commons, is an essential service for the country. All MPs are also essential workers, though in order to respect public health standards, parties have wisely decided to reduce the numbers of MPs attending sittings, and the House administration has also restricted the number of public servants to only those who are absolutely necessary for Parliament to function. I'd like to point out that for the committee's information that in 1916, the House sat the day after the fire that destroyed the Centre Block, and in 2014, the House sat the day after the October 22nd shooting.
Encouraging to see the House on Monday take steps towards resuming operations. It is a start, but more can be done. The committee has already been made fully aware of the finite capacity of the House administration to deliver a virtual House on short notice. Indeed, the technical challenges are immense and were evident at the committee meeting 2 days ago. Clearly, it will not be possible next Tuesday for all members of the House to participate.
Despite the superhuman efforts on the part of House staff, led on the technical side by Stéphane Aubé's team and on the procedural side by Deputy Clerk André Gagnon's team, the physical and technical limits of a virtual House are significant and numerous. I am confident that these individuals will do everything they can to make this work eventually, but I would ask you to be patient and to understand that they can only do what is in the art of the possible.
These realities and the need to fully take into account legal, procedural, and constitutional considerations, it would, in my view, be preferable to move quickly to a hybrid model of House sittings. By this, I mean in-person sittings augmented by virtual participation, for which the number of attendees would gradually increase as the House administration's capacity increases. In-person sittings conducted as has been done so far, with limited attendance that respects the proportions of the House, obviates any concerns related to sections 16 and 48 of the Constitution, namely Ottawa as the seat of government and the need for a quorum. As an aside, I am perplexed as to why, for the special committee agreed to on Monday, the quorum is set at only 7, when in reality it is to all intents and purposes a committee of the whole House, where the quorum is 20, as it is for the House in full sitting. A hybrid approach has the benefit of retaining for members and the House the flexibility and agility afforded by in-person sittings, while respecting public health guidelines by supplementing such sittings with virtual participation that has the added benefit of safely ensuring cross-country representation. That virtual participation will increase in numbers and efficiency over time. This way, Canadians continue to see the physical House in action on a regular basis, are reassured to see that their key democratic institution is functioning, and thus a return to normalcy begins ever so modestly. Public confidence is increased by a regular and visible challenge function to the actions taken by the executive. As representatives of all parties and regions are heard, all Canadians will feel that their views and concerns are being expressed.
Naturally, there are still several procedural details to work out, especially with respect to virtual sittings. For example, how will the Speaker know which minister should be acknowledged during a virtual question period? How will points of orders be dealt with and questions of privilege? And what about question and comments periods during a debate? What about recorded divisions? The list goes on, and it's a long one. I do, however, have full confidence that the procedural services team we'll be able to support the Speaker and the House and find creative solutions for most of these issues. One thing is clear. Each approach will require a collaborative, patient, and constructive way of working on the part of all parties. Things must be simple in order to be able to focus on the true function of Parliament, that is, to legislate, have supply, deal with supply, and keep the government accountable.
To votes, one possible avenue to explore is to build on the existing practice of applied votes by the whips, which is already routinely used, mostly in instances where the House is faced with large numbers of votes. On the other hand, if a purely technological solution is preferred, I am sure that House procedural and technical staff could advise the committee on how to devise a method of remote voting for virtual participants. These are just a few of the issues the committee and ultimately the House will need to consider in the days, weeks, and months ahead. A deadline such as that imposed on this committee in the current context is not, in my view, realistic if the committee wishes to thoroughly explore the subject area of virtual sittings. It is an extremely complex issue with broad implications and would benefit from a longer, more in-depth study. As such, the committee may wish to present an initial report and then continue its consideration of this subject matter beyond the terms of its order of reference. Voici qui met fin à mes...
That ends my opening remarks, and I will be happy to answer any of your questions.
Thank you, Mr. Bosc. We appreciate all your experiences and your many appearances before this committee in the past as well. Mr. McFarland, please.
I want to thank the committee for inviting me to join you today. In the written submission I outline a short set of disparate constitutional issues and principles that I hope will guide your decision-making on virtual activities in the House. A key concern about Parliament's role during the pandemic is that all MPs be able to participate as fully as practicably possible. Because in-person meetings of the full House are not possible and possibly for quite some time, this means undertaking a serious consideration of the full range of virtual activities, including remote voting. A skeletal Parliament is not a substitute for the breadth and depth of debate and deliberation, question posing, and responsibility to vote on bills and motions by all of our elected representatives, be they members of recognized parties or independents. Another reason for concern about the skeletal Parliament so far is that it has not ensured all regions and provinces are properly represented. While the Senate is properly regarded as the chamber of regional representation, and so regional or provincial representation within the House is not necessarily a formal legal requirement for any given sitting, I think ensuring such representation in the House is consistent with the broader principle of federalism, and certainly from a political and legitimacy perspective. Moreover, as central as political parties are to our system, our House of Commons is ultimately founded upon elected representatives at the riding level. No voters in any riding deserve to have a representative who can only fulfill part of their ordinary role. Maximizing what can be done virtually is the best way to facilitate full participation during this ongoing emergency. One of the biggest obstacles to online voting by members is possibly the Constitution. Although much virtual activity may be facilitated by changes to the standing orders, permitting distance voting likely requires a formal amendment to the Constitution Act of 1867. And I think this is by virtue of the language, particularly of sections 48 and 49. Section 48 refers to the presence of members necessary to constitute a meeting of the House for the exercise of its powers. And the language of section 49 certainly implies a physical presence in the House for voting purposes. However, Parliament has clear authority to amend these provisions unilaterally under our amending formula. And as a result, the necessary amendments to facilitate online voting by MPs can be brought into effect by an act of parliament. Another obstacle suggested by some commentators is that meeting virtually clouds the application of parliamentary privilege. And it is true that courts have been reluctant to expand the scope of privilege beyond parliamentary activities. In determining the scope of privilege, however, courts have quite consistently framed their analysis in terms of the sphere of activity or the content of the parliamentary function, not the venue or process by which that activity is pursued. So while I'm not an expert on parliamentary privilege specifically, it is difficult to see how privilege would not extend to core parliamentary duties of individual members if conducted in a virtual context. Nonetheless, formalizing virtual processes through changes to the standing orders or even the Parliament of Canada Act may help to ensure that such activities are regarded by courts as being core to the formal legislative process. As for practical and technological considerations, it's clear that there's a lot to be worked out. My political science colleague, Nicole Goodman, and others have written about how something like distance voting can be facilitated. It is even a recommendation by a recent report of the Commonwealth Parliamentary Association. Samara Canada has discussed some of the other challenges as well, but I agree with their position that these can be worked out. I do think that formalizing provisions to enable virtual activities, including voting, is important, not only for the next months, but as future contingency. At the same time, however, I think that any changes to the standing orders or statutes like the Parliament of Canada Act or even the Constitution Act that aim to facilitate virtual processes should be framed explicitly as emergency measures. Provisions for virtual participation should be regarded as a temporary stopgap measure to ensure that Parliament can continue to play its fundamental role to the best degree possible, but they cannot replace an in-person Parliament during normal times. Finally, I do not have any opinion about the frequency of sittings of the House during the pandemic. There are clear reasons in favor of ensuring Parliament continues to sit and that its activities be as robust as possible. But the number of days per week or the length of any breaks in sitting are hardly scientific propositions, and that they can be left to the resolution of the various parties. I'll leave it at that for now, and I look forward to your questions.
Thank you, Mr. McFarlane. We appreciate all the witnesses that have submitted written submissions to the committee, and those are valuable as well. And we'll move on to Honorable Peter Milliken, please.
I'm not much of an expert on this subject, but having said that, I've recently been, as a member of various boards of community or charitable organizations, have had to attend a lot of meetings in this kind of format. And so I've actually done quite a number in the last few weeks, never mind the months before, because sometimes they have their meetings in this fashion. And I mean that like the one we have now, where you can see everybody on the screen or see their name, which in my view is quite an important part of this and would be very difficult in my view for sittings of the entire House. Having over 300 people on your screen is not going to work. It would be tricky, to say the least. So I, in thinking about this, when I was asked to make some submissions on this subject, thought that the first thing I'd say is, in my view, this could work for committees. And I think it could work reasonably well if a committee wants to have a meeting and consider legislation. They could have a meeting somewhere on Parliament Hill in one of the committee rooms with a few MPs present that happen to be in town or whatever, and then have all the others connected on one of these devices and continue a fairly normal meeting that way. I say fairly normal because the chairman of the committee can see who is there. Members could indicate by holding up their hand that they wish to speak next, which we do on some of the boards I sit on. And then the chairman of the committee can recognize the person who wishes to ask a question or make a statement, and then move on to the next, and so on through the proceedings. But in a meeting of the House of Commons, that is going to be extremely difficult when you've got so many people wanting to, potentially wanting to participate at different times and on different things, and where you're going to have votes that are going to have to be counted by somebody who can watch the pictures of the members and then get a vote. It's going to be a complicated, very complicated process. And it's not one that I think is going to be terribly helpful, but as some of the others have suggested in their comments, if we have a situation where we have like the current health situation in the country, we need to be able to have Parliament continue to do some of its functions at least, and deal with important legislative matters. And maybe this is the only way to do it. The other part of this is that I'm particularly concerned about is how the speaker is to choose persons to speak and ask questions and all that sort of thing from this kind of screen arrangement. As I've said, in a committee where you've got a fairly limited number of participants, not so bad. But in the full House, how is the speaker to know who is going to be next from which party and all that sort of stuff? Yes, in question period, we have an order by party and so on. But you need to find out who is going to be the one asking the questions and the points of order as well that come up from time to time. How do you have a member indicate he or she wishes to raise a point of order or a question of privilege, and signal that to the speaker in a way that might attract attention on a screen of this kind when you have that many possible people on the screen? It's going to be very difficult to catch this, I think. But I'm not an expert on this.
Just wanted to say, Mr. Milliken, that there is another function that, I mean, I don't know what application would ever be used for a virtual parliament, but for right now, we're using Zoom for committee. Right. And you don't just have to signal, but there's also a button you can push to raise your hand, and it gets prioritized according to who raised their hand first. Right. So there are some, I think, unique solutions being discovered at this time.
Yes, I agree. I'm almost all my meetings have been Zoom meetings, so I feel fairly familiar with this in some ways. But as I say, when it's a much bigger screen, or potentially 10 times as many people at least on there, it's going to be very difficult, I think, to examine it and see who's popping up, unless there's some technology that can have people that push the button have theirs all go to the front. The other thing that I've noticed in our meetings is you can turn off your silence thing there, and then start to speak. And members were interrupting one another frequently in these board meetings, not intentionally. It's just 2 or 3 will start speaking at the same time, and then the chair has to calm them down and choose one and say, "You're going first," and the others, "Please be quiet." It's not a straightforward process, and I'm just concerned as a means of dealing with a large number of people, it's going to be even more difficult for that, because what could happen is what happens in the House with heckling. You push off your silent button and start heckling the member who's speaking or making a speech if you disagree with what he or she is saying or want to challenge the member. And you could have a whole bunch of people doing that at the same time, because once one starts, the others could respond by saying, "You're not supposed to be speaking, shut up," and all that sort of stuff that can go on. As happens in the chamber, it would make it very difficult, I think, for the presiding officer on a television, if I can call this a screen show of this kind, to manage the disorder. So it's a numbers game, in my view, that is important here. The other possibility is when there is a crisis like this, there could be some worked out arrangement whereby the House would only sit for, say, a day a week. And on those days, new legislation could be introduced and referred to committees right away. And then the next week, more of that, but then maybe some committee reports will come back with suggested changes to the legislation that could be adopted. And then if the parties agree, there could be a vote on third reading or second reading with approval of the amendments, whatever, and then get on with it without having lengthy debates at those stages of the bill. That could happen too, and there might be some willingness to do that, at least on matters of national importance that Parliament might have to deal with, where we're not sitting for 3 or 4 months because of this kind of infectious move. So I think those are possibilities for avoiding lengthy chamber sittings, but also it would mean that most of the work done on these devices, on computers, would be committee work. And as I say, I think committees could function reasonably well compared with the House, given size, if the committee could have a meeting as we're having here now, because the parties could express their views, each of the members would get his or her say, witnesses could be called and questioned by the various members, and the chairman of the committee can see who's next by the colors that light up on people's screens if they push the button or whatever. And it's relatively easily managed because of the much smaller number. And I say that having sat on these boards and watched it go on. It's not that I'm wildly in favor of this method instead of an in-person meeting, but it's not that bad in my experience, except for the fact that you do have these the lack of control in who speaks, because a bunch of people can do it all at once, and you then have to have somebody say, "Hey, wait, we've got to hear just one first because we can't hear everybody at the same time," and calm them down. But that happens in the House too. But it's a different situation there. So those are the points that I thought I'd suggest here. I think obviously there's going to have to be some good process for identification of the person, a picture like this, a camera, whatever, that picks people up. That needs to be part of the process, in my view, so you can see who's there and who is doing the talking, and not somebody substituting for the member. I think it's important too that the options for intervening in debate should be somewhat limited if the debate's taking place in this format. We don't need to have questions and comments at length at the end of a member's speech. We don't need to have questions of privilege and points of order raised frequently during, which could happen. But some of that will, without much control. It still is an issue that's going to have to be dealt with, and might be a little harder for the speaker to deal with, as I say, and where you can't always see what's going on in the background and with the person who's appearing, because there could be other people in the room with the MP that's speaking who are yelling at him or her, or telling him to do something else, or passing him notes that could be causing consternation among some of the people watching. So it's an area of, I think, potential crisis or problem, but one that may be important from the point of view of House perspective, where we have this lengthy period where we're not to meet up or sit close to somebody or be close to somebody else because of this ailment that our country's suffering from at the moment and much of the world.
Thank you.
Okay.
Thank you very much, Mr. Milliken. We're so honored to have you with us here. Presiding over 4 different parliaments is indeed no small feat. So it's wonderful to have you on the panel. I'm learning as we go as well how to use some of the features on what we're using right now, Zoom. And we actually do have the capability of to mute people or to turn their mics on when needed. So you can have that control, which I think is a great ability to have in some of these meetings when you have a lot of people, but definitely hear everything else that you're saying. There's many challenges involved. So next, can we hear from Monsieur Pelletier, please?
Oui, merci de m'avoir.
Thank you. And thank you for inviting me to this panel. I'm very honored. And I'd like to say that I have the impression that I'm participating in the creation of something that's entirely new. I will be looking at today's topic through a constitutional lens because I'm known as a constitutional expert as well. But I'll be looking at it from that point of view rather than from a legal point of view. That is, how Parliament can sit virtually. So I'll be looking at this from a more global point of view rather than give you the kinds of details that Speaker Milliken gave you. Only a former Speaker of the House like Mr. Milliken is able to give you these kinds of details. I don't have that expertise. So I'm going to look at this from a constitutional viewpoint, and I'll be focusing on the House of Commons. I didn't focus on the Senate in my opening remarks. But whatever I say about the House can probably be applied to the Senate as well, even though I've looked particularly at the House of Commons. Now, for the purposes of my contribution, I looked at various sources, the legal and constitutional sources. I looked at the Constitution Act of 1867 and the Constitution Act of 1982. I also looked at the Parliament of Canada Act and the Canada Elections Act. I've also been interested in the rules that have been drawn up by the House of Commons itself. And there are also constitutional conventions. As we know, conventions are very important in Parliament. I could tell you from the outset that I actually found no constitutional constraints to the House of Commons sitting virtually. In other words, the conclusion I draw from my research into this is that there is nothing that in the Constitution that prevents the House from sitting virtually. However, in the Constitution, there are a number of principles that need to be respected to the extent that they are respected in Parliament and to the extent that they can be respected virtually. Now, the Constitution contains conditions and requirements that one cannot get around when it comes to parliamentary proceedings. It is possible for the Parliament of Canada itself to amend certain provisions in the Constitution. Now, with respect to these unavoidable provisions, there is the obligation for Parliament to have at least one sitting under Section 5 of the Constitution Act in 1982. So the longest term as well of Parliament, term in office, is 5 years. The Speaker of the House of Commons must preside over all sittings. That's Section 46 of the 1867 Constitution. 1867 Constitution. Quorum is 20 under Section 48 of the 1867 Constitution Act. Matters also have to be decided by majority vote under Section 49 of the Constitution Act as well. English and French has to be allowed to be used in debates, and both languages in records, minutes, and journals. And that's under Section 133 of the 1867 Constitution Act. The Governor General always has the power to dissolve under Section 50 of the 1867 Constitution Act. The principle of responsible government also has to be respected. That's a constitutional convention. And that has been acquired over time. The convention has evolved over time. There has to be immunity for interventions made in the House. Otherwise, there's absolute immunity with respect to what a member says or does in the House. That always stands and must stand. This immunity applies to the work of the House, not actually to the physical location where the House normally meets. So, in fact, it applies to the work that is done, but not to the building itself. And it also covers the work of parliamentary committees. I would also point out that under Section 7 to 9 of the Parliament of Canada Act, there is immunity for the broadcasting of parliamentary proceedings as well. And that also would apply and would have to be respected. I would also point out that parliamentary proceedings have to be publicized under the Publication of Statutes Act and under the Department of Public Works and Government Services Act. Now, the duties of Parliamentary Protection Service remain. Obviously, this service provides physical security throughout the parliamentary precinct and on Parliament Hill. However, two things to consider that I think are a little more difficult to deal with when it comes to virtual parliamentary proceedings. First, the House proceedings are public, and that lies at the very heart of the work of the House of Commons. This work must be public. The House of Commons has a legislative duty, and it also has the duty to deliberate and to debate, and it also keeps the government under control. That's an essential characteristic of the House of Commons. So it has to be public. And if the House of Commons moves to virtual sittings, it will have to make sure that this public nature of proceedings in the House of Commons be respected. And I would say the last point, the last condition, would be media. It is absolutely essential that the House of Commons be available to the media. And so if the House of Commons is to move to virtual sittings, then it will have to find a way to make sure that the media can still play their role and that their role is not impacted by the fact that it will be sitting virtually. That is absolutely essential to the House of Commons sitting. And so I would tell you that when I look at what the nature of the House of Commons is, and when I look at the Constitution Acts, and when I look at constitutional conventions and applicable legislation, I actually see nothing at the face of it preventing the House of Commons from sitting virtually. Obviously, a number of conditions, such as those I just listed, have to be complied with. Thank you.
You're muted, Ruby.
Sorry. See, we all still make some mistakes sometimes. Next but not least, we have Mr. Gregory Tardy, please. Perfect. Yes, we can hear you now.
Okay. I'd like to thank the committee for extending an invitation to me to participate in today's proceedings. You mentioned that I'm representing here the Institute of Parliamentary and Political Law. In addition to that, part of my background is 15 years spent in the office of the law clerk. So that is hopefully of some use in this process.
Absolutely.
Given the relatively short amount of time available, I'd like to address in summary fashion the terms of reference that the committee adopted in respect of today's proceedings. I've sent the committee clerk a written version of my more detailed comments, and I understand that that document is now being translated. I think, first of all, there is a constitutional foundation for the position of Ottawa as the capital of Canada, and that is complemented by the convention that a capital city of a country should, in normal circumstances, be the seat of its government, including legislative, executive, and judicial institutions. There exists, therefore, I think, a legitimate expectation that the Parliament should meet in Ottawa, but that expectation is refutable. And I think I join in that sentiment, some of the comments made a few days ago by Philippe Dufresne. We can ask, what is the work that parliamentarians are asked to accomplish? And more to the point, what gives rise to parliamentarians' ability to conduct that work? Recent Supreme Court jurisprudence tells us that the members of the House of Commons legislate, deliberate, and hold the government to account. The condition precedent to enable MPs to perform these various tasks is the requirement for quorum. And this brings us to the core of the issue, I believe. This core issue we're asked to address today is the validity of a proposal to have the House of Commons sit and to have MPs conduct their work in what the committee mandate calls alternate locations. The committee study may, to some extent, have been overtaken by the House decision reached on Monday, April 20th, to divide its work between in-person sittings in Ottawa and virtual sittings, including other locations in Canada. Nevertheless, the present study is constructive in providing such a decision with a sound footing in law. The legal validity of the issue of holding meetings involving both Ottawa and alternate locations, or of holding virtual meetings across the country, hinges on the current understanding of the concept of quorum. In my opinion, the essence of the matter is that while the meaning of quorum in 1867 was understood to be simultaneous physical presence of the participants, that is no longer the case today. Considering advances in technology in 2020, it is possible and certainly more appropriate to think of quorum no longer as simultaneous physical presence, but based on the notion of participation and a virtual meeting of the minds, so to speak, wherever the MPs in question may be located. This notion of participation as the basis of quorum is in fact supported by legal analysis in two mutually enforcing ways. The first is the purposive approach that has been adopted by the Supreme Court of Canada in recent years. What matters is the general purpose of a rule such as that dealing with quorum. That purpose must be interpreted according to the real life conditions at the time the rule is interpreted, that is today, not according to the world as it was in 1867. Second, the holding of meetings in alternate locations or using technology enabling virtual presence is, I believe, in line with the Supreme Court understanding of the national emergency branch of the peace, order, and good government doctrine. COVID-19 has incontestably started an emergency and one that is national in scope. The House of Commons, therefore, has the requisite rational basis, I believe, for resorting to extraordinary measures. I submit that the understanding of quorum put forward here is in line with the concepts of parliamentary privilege. The requirements for meetings are part of the internal organization of the House and therefore subject only to House decision-making. On a separate but related note, the House will have to devote particular attention to other aspects of parliamentary privilege, dealing with alternate locations or virtual meetings. Most notably, it will be important for the House to decide whether it considers that privileges of freedom of expression apply to MPs in various locations across the country, other than the chamber of the House of Commons situated in the city of Ottawa. And finally, what appears from the mandate of the committee is that it's very important, and I think Mr. Milliken just underlined this. It's very important to understand that the technical support rendering meetings involving alternate locations or virtual meetings must be as absolutely fail-safe as possible. The questions put to the committee today require analysis of several other significant aspects. I examined those in greater detail in my written submission. Évidemment, je suis prêt à répondre à vos questions, soit en français ou en anglais, comme vous voulez.
I'll be quite willing to answer your questions in French or English. Thank you.
Thank you so much, Mr. Tardy. Now we will continue into our first round of questioning, and the first questioner is Mr. Richards for 6 minutes, please.
Thanks, Madam Chair. I've got about 4 questions, and I want to ask both Mr. Bosk and Mr. Milliken to provide some responses to the questions. Because there is 4 questions, and maybe I'll ask on the first question if you could just give me a yes or no, each of you, and then we can maybe get some brief answers on the other 3 from each of you. So the first question I had, I know Mr. Bosk, you indicated in your opening remarks that you thought the idea of just virtual sittings might not necessarily be the best idea, but talked about a hybrid model. I just wanted to kind of, I think, confirm from both of you that I think it was fairly clear in your opening remarks, but I just wanted to be sure that you both felt that the idea of just straight up virtual sittings of all, of all MPs would be pretty difficult or not an advisable thing, given that we're trying to do this fairly quickly when we're looking at, hundreds of years of parliamentary experience, and we're talking about 5 meetings to sort of study this. Was I accurate portraying, both of you, that you feel this would maybe be not the best thing to rush into? Would that be accurate? Yes or no on that one from each of you?
I'd say yes, that's accurate. I think I'm not opposed to having them, but I think they're going to be very difficult to manage properly. So that's why I suggested maybe 1 or 2 sitting days a week max, where the House would sit and deal with very limited stuff and send a lot to the committees and let the committees keep doing their work. Because when it comes back after the illness is finished or done with, the House can meet for longer hours and everything and deal with all this stuff that's been studied in a much more efficient way than if it waits and deals with it all again when it comes back.
Fair enough. Mr. Bosk, a yes or no on that one?
I agree that purely virtual sittings carry a lot of potential difficulty, both technically and procedurally. So on that score, I agree with former Speaker Milliken.
Okay, and so both of you again, on that same point, like, would you say that one of the issues would be in the idea of parliamentary privilege, for the ability to accommodate all 338 MPs? There certainly is a potential, I would think, that we see a breach of parliamentary privilege when someone isn't able to participate properly, whether that be because they haven't got good internet connections in their constituency or for other reasons. Would the 2 of you share those concerns about parliamentary privilege, and why or why not?
I'll let Speaker Milliken go first.
Okay.
Well, I guess it would be a matter of privilege if they couldn't get into it. I hadn't thought of that as an issue, but they don't have to do it from their own riding. They could go to provincial capital or a nearby city that's maybe not in their constituency and do the work from there. They don't have to be in their house or in their office to do this, I don't think. But it depends what restrictions the House chooses to put on it. And again, I don't think there's any reason why you couldn't have a group of members of Parliament in one place that are all participating in the discussion like this, maybe all in your office, whatever, and doing it together. Technically, it could be done that way. It might not be something that other members would like much, but I don't think you'd be required to be in a room on your own for this to happen. I don't know how anybody could tell that that was the way it was being done if the other people were just out of sight of the camera.
I'll just add very briefly. Ms. Bain, I think, suggested on Tuesday that some members could get to a location where connections were better and participate in that way. I would simply add that each case would have to be looked at on its merits. You know, if there's a snowstorm in one part of the country and people can't participate in a sitting of the House continues. You know, each case is going to be have to be looked at on its own particular circumstances and merits.
Sure. Okay. And you know, I guess another thought that you know would be you know, in the House, of course, when debate is occurring, you know, if a member that's, you know, sort of scheduled to speak, I guess we'll say, you know, isn't there and doesn't rise to speak, and there's no one else that, of course, that rises, you know, debate can collapse. So what about in those situations where they have, you know, a bad connection that comes up, or the microphone might not be working, and so then, you know, obviously there's no ability to recognize that they're speaking. How would you see that playing out in a virtual type of a sitting? Like, would that maybe cause the collapse of debate, for example, if we couldn't get the connection up and running for several minutes and there was nobody else sort of available or, you know, ready to speak? Yeah. And I guess we wouldn't even really know what's the reason the person's not rising. Essentially, is it because they're, you know, connections trouble somewhere? What is it? So, wanted to hear your thoughts on that.
Well, if I can just jump in really quickly and leave more time to Speaker Milliken. The reason I'm in favor of something like a hybrid arrangement is that it preserves for the House this agility and flexibility for just those kinds of circumstances that you've mentioned. It just takes that all away. There's people from each party in the House physically, and they can jump up and say, no, there is no unanimous consent, or hang on, we're not ready to put the question yet, or just a second, we've got a member who wants to participate in debate but can't get a connection, that kind of thing. So that's why I like the flexibility that a hybrid model gives you. It brings in as many people as possible, but it preserves all the good things that the House in actual sitting allows you to do.
Thank you, Mr. Bosca. That's all the time we have for questions. I do want to confirm, Mr. Tucker, you have your hand raised. Is it because you'd like to intervene or raise a point of order or something?
No, I'm just wanting to be next in line to question, please.
Okay, you are next in line. You will have 5 minutes in the second round here. So yes, you will be acknowledged. And this, I think, is a perfect opportunity for me to reiterate again some of the rules I mentioned at the beginning of the meeting, that if you do want to make a point of order, you just unmute your mic and you go ahead and you can interrupt and make that point of order. But after that, if you want to speak to that point of order, it's best if you raise your hand in the participant list, and then I get a generated list according to who's raised their hand first. And it's very easy for me to identify the speaking order from that list. So those are the rules if that does occur.
No, I'm aware of that, and that's how I was following, and I'm just waiting here. So there's little technology issues here, obviously.
Okay, thank you. No, you will be next on for the conservative speaking list. Next up is Mr. Garretson for 6 minutes, please.
Thank you very much, Madam Chair, and thank you to our guests, in particular my predecessor, Mr. Milliken, who's here today. Speaker Milliken, a quick question for you. Yesterday, or the last meeting 2 days ago, we had the current Speaker of the House on, and I asked him, given the advice from Health Canada, and given the fact that he is ultimately responsible for the employees of the House of Commons, would it be his position to heed the advice and exercise social distancing as maximum as possible within the House of Commons, given his position there? And he said yes, he would. As a former speaker, would you have taken the same advice from Health Canada and done everything you can to maximize that? You're on mute.
Am I off now? Okay.
Yeah.
I don't know. I never had to deal with this kind of issue when I was in office.
Yeah.
Never saw it happen. So I'm sure I would have taken the advice.
Taking the advice. Okay. Thank you. Mr. McFarland or Mr. Pelletier, help me understand the basic principle of parliamentary privilege. My understanding of it is that at the most fundamental core, it's that all members have access to the same opportunities and the same rights in terms of being present for meetings, so on and so forth, having access to the Hill. Is my understanding of that correct? Either Mr. McFarland?
Well, that's certainly one part of privilege, and you know, there are institutional and individual level components to parliamentary privilege. One of the other individual level components is individual immunity for things like freedom of speech purposes.
Right.
And so we could elaborate on those different ones, but what you point to is certainly one part of that, yeah.
But as a fundamental principle of parliamentary privilege, it's that members have the same rights to represent them, because, you know, and no member has a superior amount of privilege. Like, would a cabinet minister have a superior amount of privilege?
No, not in the way I understand privilege.
Right. Mr. Pelletier, what are your thoughts on that? You're on mute.
Je vais vous répondre d'abord en français, si vous voulez.
Eh bien, oui.
Et puis je vais...
I will answer in French, and then I'll add a few words in English. Immunity and privilege are recognized for all members equally. I don't see a distinction between members.
He is related to the works of the chamber.
Thank you.
It's not related to the house in itself, to a building.
It's related to the work.
It's related.
That's a very good
to the
point.
works of the chamber. So,
So
it means that a member has an absolute immunity for everything that he or she says or does within the works of the chamber.
And I'm more interested in what they have access to. For example, some members could argue that a minister some ministers have been in every session of parliament since this emergency, whereas some other members have not been to any. And I'm curious about, so Mr. Bosque, would you agree with that assessment of parliamentary privilege, that all members should have equal access? You're on mute.
Mr. Bosque, mute.
You're on mute again.
Okay, sorry about that. You know, I tend to agree with Mr. Pelletier. I think all members have this immunity in the same fashion, and attendance is a tricky one, because depending on what the cause of the difficulty in attending might be, I think has a big impact on how a speaker might rule on a question of privilege raised on that basis.
So I guess, Mr. Bosque, like, what I'm having a really hard time wrapping my head around is that this idea of a hybrid model that you've been talking about relies on certain members, and by your description, it was members that would be selected by party to represent the basic composition of the House. Certain members would be allowed to be in the House, and certain members would be allowed to participate virtually. And I have a hard time wrapping my head around that hybrid model and how it cannot be some members' privileges are impugned upon because their access is at a different level. It would appear to me that a much more even access would be that everybody has access the same way. So if that way was to be done virtually, at least you can say every member has the same access to the meeting, whereas this model that somehow is a hybrid would suggest that certain members have access that other members don't.
I don't share your concern at all on that point.
I appreciate that. Thank you.
I would just add quickly that that's the reason to try to maximize what can be done virtually.
Right, but I guess what I'm getting is that it really comes down to everybody being treated fairly,
all
not
the
certain
time.
people being
That's
treated
all the time we have.
Thank you.
Thank you, Mr. Gerritsen. Next, we have Mademoiselle Norman Day, please.
Merci beaucoup.
Thank you very much. And I'd like to begin by thanking all our panelists for coming. I feel truly spoiled to be able to speak to you. I have a first question with a bit of a preamble. Parliamentary privilege for a member includes being able to go to the House and take the floor. Now, during this crisis, there may be people with more precarious health or who are older, and they may decide not to go for various reasons and have a virtual and attend virtually. Now, my question is this. Some MPs feel that by sitting virtually, we're also prevented from sending notes to each other, communicating, and so it's harder actually to have accountability. So I'd like to know if, even if our questions go through the speaker, can we make sure that the person answering is physically there? Could that be part of parliamentary privilege? Well, I'll begin. If I understood what you were asking, you're talking about the possibility of someone being given assistance, for example, while they're answering questions. Now, ministers can receive emails, notes. They regularly receive assistance from outside. So I don't necessarily see a difference in a virtual sitting if you're talking about actually if there's a difference between ministers being there physically or not in terms of the information they can receive. Thank you. My second question is this. I think I understood that Section 49 of the Constitutional Act implies that a member's presence must be physical because there are questions that are raised in the House. So under that section, does the definition of the House of Commons apply to a physical space, or are we talking about the concept of the presence of members? Well, with your permission, I'll respond if you can all hear me. I think you have to go back to what the meaning of Parliament is. A Parliament is an assembly of people. It's a meeting of people who are exercising legislative duties. So a physical space is actually of secondary importance. You can respect the heart of what that assembly means if you're having a virtual meeting, as long as you are complying with a certain number of conditions set out in the Constitution. Now, in the case of Section 49 of the Constitutional Act of 1867, there is no requirement for a physical presence. There is a rule for votes, but nothing precludes those votes from happening virtually. What is stated is that a majority vote counts, and when there's an equal number of votes, then the Speaker decides. Thank you. So if we were to imagine what this will be, and even if we were to amend the Constitution, you're saying that all it would require to make changes is for a House to vote. So all we need actually is to respect the majority vote, and Section 41E wouldn't apply. You wouldn't also need provinces to vote if you wanted to amend a part of the Constitution? Well, where Section 44 applies, it's a simple majority vote when you're adopting legislation, when the House wants to pass legislation, as well as the Senate, and then, of course, there's the royal assent. That being said, though, and here I'm thinking of the 2014 ruling of the Supreme Court regarding the Senate. It would not be possible for the Parliament of Canada to change something that is part of the essence of the House of Commons. It wouldn't be able to change its essential characteristics. What does that mean? Well, it means that if the Parliament of Canada has the right to amend under Section 44, the Constitutional Act of 1982, there are limits to that. And that hasn't necessarily been defined by the Supreme Court yet, but there are limits. And you can't have a unilateral amendment to the Constitution. Thank you. Members of the House of Commons participate in proceedings and questions and comments on debates and question period. And the purpose is to focus on what the intent of the topic at hand is. Is there any difference, do you think, legally to virtual debates and physical debates? For example, would the Blues, would Hansard have the same status? Would everything have the same status, whether it takes place inside the House or out? Well, as I said earlier, this is new. Let's not forget that this is a new situation. The situation is evolving, and privileges will probably evolve in light of recent events. That being said, if a statement is made in the House by authority of the House, presided over by a speaker, as set out in the Constitution, then virtual words and statements have the same power and status as those pronounced within the physical House of the Commons. I absolutely agree.
I believe Ms. May has raised her hand, and I'm assuming that you would like to receive some time. So I'm just putting it out to all of the members. If any of you would like to share your time with Ms. May, please, raise your hand and let me know. Next, we're moving on to Ms. Blaney.
Thank you, and I want to thank everybody so much for being here today. And these are interesting times, and I think that as we go into this conversation, we have to understand just what a complex question we're really approaching through this process. And it's very good to have experts like yourselves here to help us through that process. So my questions are going to be going to Mr. Bosque and Mr. Tardy. First of all, both of you have mentioned that the timeline of this study is relatively short for the capacity and the gravity of this conversation. So I guess, first of all, I would like to hear from both of you on what your recommendations or thoughts are on how long the study should take, or is there particular parts when you look over the process that we've laid out that you would recommend us expanding on? Thank you.
Well, I hesitate to put a time frame on it, but I do know that May 15th is not enough time. That is for sure. You just don't have enough time to properly absorb the information and arrive at conclusions that really cover all the aspects that have been raised and need consideration, in my view.
Mr. Tardy, you're on mute. You're muted. Thank you.
I agree entirely with Mark Bosque's interpretation of this. In order to answer your question properly, I think the first step should be to distinguish between what is the most pressing and urgent aspect of this ensemble of questions, get those resolved first, and then add in details as solutions present themselves.
Thank you. So one of the things in the last meeting with the law clerk and the clerk of the House, they talked about what can we do to create a process to move into as needed. This sort of hit us by surprise. We're trying to adapt as quickly as possible. We have multiple committees happening. We're working on finding ways to question and hold the government to account, which is our job as opposition parties, and something that I believe the government respects and understands keeps them more healthy. So as we move towards trying to discover what a virtual parliament could look like. I'm just wondering if there's any thoughts on a staggered approach. You know, I think when we initially look at it, and I think that's what we're going to see out coming next week, is a committee of COVID-19 committee in the House that will be discussing certain issues related to that. So it's about holding the government to account. So I'm just wondering if you have any thoughts on, you know, this is a short period of time. Is there an approach that could be staggered? You know, there are some specific challenges, and you both have mentioned them: questions of privilege, points of orders, getting notice from the speaker. I'm just wondering if you have any thoughts on a staggered approach to this. And that's to Mr. Bosk and Mr. Tardy. Mr. Tardy, maybe you can go first.
As you were framing the question, my thought was that nobody in this meeting has yet talked about using international examples. In the last week or 10 days, the Parliament at Westminster has made considerable progress in terms of the development of what in today's documents is called alternate locations and a virtual House of Commons. The physical advantage, so to speak, that the Brits have on us is absolutely much more compact geography and one single time zone. That having been said, it would be quite useful, I think, to consult with our colleagues in London to see what kinds of procedures and what kinds of supporting technologies they have adopted.
Mr. Bosk.
Simply to say that a staggered approach is definitely the way to go. One of the ways that could be done, in fact, it's sort of already been started with the way committees have been started up again. It's been done on a subject matter basis, and so I can easily see, say, a question period done on a thematic basis, where you'd say, okay, we're going to have these 3 ministers here today, and these other 3 ministers here next week, and so on, so that you build up to a full resumption as the technology catches up and as the health situation abates. You can continue to build up in that way. In terms of the procedures, I'm confident that the team around the speaker is, the procedural services team is going to be able to look at all these issues, the practicalities that Speaker Milliken referred to, and come up with ideas. As long as the parties go along with it and are willing to be patient and cooperative, I think it can work.
Well, and that's something that I heard multiple times in your presentation, is that sort of patience and understanding as the process unfolds. Mr. Tardy, you talked in your briefing about having 2 different types of working groups to help us through this process, one being legal advisors that look at what other democracies are doing, and the other one around technical experts to make sure there's a fail-safe approach to protect MPs' identity for their access. I'm just wondering if you could touch on that. I didn't leave you a lot of time, sorry.
Very quickly, in 10 seconds, please.
In 10 seconds, I think each of the groups of advisors have different contributions to make, and in the process of making the recommendations, it's important to have them virtually meet together so that the advice given to parliamentarians is complete and that it makes sense in both legal and technical terms.
Thank you.
Thank you so much. We're going to carry on with our 5-minute round with Mr. Tucker up first.
Thank you, everybody, and thank you for the presenters today. Got a couple of questions. First off, to Mr. Bosk, I was wanting to get your comments and on if we rolled out a system where not all 338 MPs could log on to, what would be the impact of rolling out a system that doesn't allow everybody to access it online? I'm sorry, I can't hear back.
No, I'm sorry, I was muted. First of all, you have to remember that right now all the House has is a special committee that's going to meet 3 times a week. The House has made a decision that it wants to start that next Tuesday. And that's a decision that's already been made. So it is physically impossible, I think, based on what I understand, for all members to participate next Tuesday. As time goes by, that capacity will increase. But the House has already made that decision that it's willing to go ahead with that, knowing that. So I can't question the House's decision in that respect.
But if we roll that out, just in general practical sense, is that if not everyone could access it, that's a breach of privilege to a certain degree. But I'll kind of switch gears just a little bit. And on Tuesday, I brought up the reference to the North American Act and some of the constitutional issues that we have with the proposal that's going forward. And one of the, is to probably the question I guess I have, or the comment is back to the Constitution. In a manner of speaking, tethers our parliamentary privileges to those held by the United Kingdom House of Commons. And maybe to Mr. Bosk, is that a fair layman's explanation?
Yes, and I think what Professor Pelletier and Speaker Milliken would say is those privileges continue as they've been in existence before in a virtual setting as well.
But what does that mean in practice, though? Like in this case, does it mean if we get more innovative than the British counterparts, we run the risk of going wide of the House of, the constitutional privileges? Is that a concern then? Or how do we tell that we haven't breached our Constitution? I'm not a constitutional lawyer, but if you're supposed to not exceed the rights of the United Kingdom House of Commons for those members, how does that square that circle?
I'm going to defer to Professor Pelletier on this one.
Alors, je vais d'abord vous répondre en français puis ajouter quelques mots en anglais.
First, I will answer in French, and then I'll continue in English simply because I'm more comfortable in French. The fact is that the initial rule in the Constitution was that privileges and immunities of the House of Commons in Canada should not be greater than those of the British parliamentarian in 1867. But that was changed, and privileges and immunities of the House of Commons cannot be greater than the British privileges and immunity at the moment where the legislation is passed. But now Canada can have privileges and immunities that are greater than those of the British parliamentarians under Section 44 of the Constitution Act 1982. So privileges and immunities in the Parliament of Canada Act can, and in some cases do, go beyond privileges and immunities in Great Britain.
Are in the Canada Parliament Act could exceed those existing in the UK, in the United Kingdom, without being invalid, without being declared unconstitutional by virtue of, because of Section 44 of the Constitution Act 1982.
Okay, thank you. That's all the time we have. Next up for 5 minutes is Mr. Alghabra.
Thank you very much, Madam Chair, and I want to thank our speakers here today. I want to thank my colleagues on the committee. And I want to just emphasize one point that I think we all agree that the role of Parliament is essential and the job of parliamentarians is essential. And we're trying to sort out how we can conduct our job given the public health advice. And a fundamental part of our jobs as members of parliament is to remain in touch with our constituents. However, today we're telling our constituents we can't meet them personally. And if you're like me and you're meeting with your constituents daily or regularly over the phone and over social media or over email. So we are, I think it's incumbent on us that we find ways as well to conduct our job, parliamentary duties as well, with some flexibility. So I want to start my question to Mr. McFarlane. If you can comment on how you saw Parliament conducted its role in passing bills C13 and C14.
Well, I mean, I think we're into an emergency situation that is less than ideal, and on an emergency basis, Parliament did what it could under existing guidelines regarding health. I think moving forward, and this is what the committee is investigating, is how do we make that a more robust process, right? So within the confines of the emergency context, I don't have a lot to criticize in terms of just getting needed pieces of legislation passed. But I think what we'd want to see going forward is more robust participation for members who could not be physically present.
And back to you, Mr. McFarlane, again. We heard from the law clerk on Tuesday saying that basically agreeing with you, saying that the House of Commons is the master of its own domain. So that the House of Commons MPs can decide amongst themselves what are the rules moving forward. And then it would be, in his opinion, given the pandemic, would be constitutional. Do you have any thoughts on that?
Yes, I mean, the reason I raised the constitutionality issue and even the idea of constitutional amendment is really not because I don't think a living tree kind of interpretation would somehow lead courts to say virtual parliament or even virtual votes were not constitutional. I think as a matter of expediency, that's how the Constitution will be interpreted. But for clarity purposes, it is actually quite important to formalize what we can do and adjustments to certain procedures as much as possible. And that goes from more specific measures in the standing orders to bigger constitutional clarifications, right? So I agree with everything that Mr. Tardy was saying about the purposive approach to understanding the Constitution, but the Constitution was written with certain assumptions, and certainly the assumption of the founders of the 1867 document were that Parliament was an in-person, one-place process. And I see no reason why this is not an opportunity to use the amending formula for Parliament itself to clarify and provide clarity to these options, even within the Act itself.
Madam Chair, I'd like to pass the rest of my time to my friend and colleague, Mr. Gerritsen.
Oh, okay. Thank you, Mr. Gerritsen.
Thank you very much. Mr. Bosk, just going back to your hybrid model, you talked about how slowly, as time went on, you could introduce more people back into the House. How would you recommend that decision be made as to who's worthy to be in the House and who still has to continue on the other side of the hybrid? You're muted right now.
Sorry. At present, parties already manage the participation of their members. That's already happening. They do. That's
been done through practice, though. So like party whips will provide lists and to the speaker.
That's right.
That's an established practice over the last, I mean, that happened just before Speaker Milliken came along. But that, we're talking about physical presence in Parliament. We're not talking about who's next on the list to speak.
Right. I don't think that you could absolutely prevent any member wishing to attend the House from doing so.
That's all the time we have, unfortunately. Next up is Mr. Broussard for 5 minutes, and after that will be Mr. Turnbull for 5 minutes.
Thank you, Madam Chair. The question that the committee is seized with on this issue is the temporary nature of what it is that we are to recommend. And I think I've heard from several of you this afternoon that having till May 15th is not enough time. It came up the other day in our meeting that not only are we looking for a temporary measure during the height of this public health crisis to try to come up with some model, but also with thoughts to the future and how what trigger points would exist in order to move us to a virtual in the event of another pandemic, for example. So I know, Mr. Boss, you talked about temporary. What danger is there going forward, or what potential danger is there if, in fact, changes to the standing orders are made, and those changes are made by the government of the day to reflect a more permanent aspect of these type of virtual sittings compared to the model that we have right now?
Well, I have a deep respect for the institution of the House of Commons. And I think, as I mentioned in my opening remarks, an overarching principle that the committee should be guided by is the importance of having that physical gathering of members in Ottawa. I think that is extremely important for citizens to be able to see their institution at work in a particular setting that they are familiar with. Visually, it's impressive. It gives it the gravitas and importance it deserves. I mean, the trappings are important. I'm not going to lie. I mean, otherwise, every day's press conferences would take place by Zoom, the way we're doing this meeting, right? But they're not happening that way. There are elements of having that particular setting that give importance to the activity. And I think that's something you need to consider.
And I think another aspect of that too, and we're seeing this on the committees as well, to Mr. Milliken's point, and I address this to you, Speaker Milliken. The committee structure right now doesn't have the same formal process under the standing orders. We can't, for example, compel government to provide documents. We can call witnesses. We've seen on the Health Committee where those witnesses don't want to come, but it's almost turned into a seminar process where we're just hearing things, but we're not actually charged with doing anything, at least on some of the other committees. The same thing can be said about, the opposition becoming an audience, to Mr. Boss's point, as opposed to an opposition that questions the government. And so my question to you, former Speaker Milliken, is on the committee structure, how important is it that it maintain the same order as it does normally if Parliament was sitting, if we move to this virtual setting, and how important is that opposition in holding the government to account? Speak, mute.
Am I still on mute? I'm sorry.
Okay.
I didn't realize I was. Am I off that?
Yes.
Yes, we can hear you.
Oh, good. I don't think there ought to be limits on the committee's power to call witnesses and stuff, regardless of how they're sitting, whether it's in person or whether it's on a screen like this, because they can perfectly easily hear witnesses, as you've just done this afternoon from a bunch of us here. And I think that's a reasonable way to go at it. As I say, for a smaller group, it's not a bad functioning thing, and particularly for committees that are having meetings with others that they may not feel safe to bring into their space, or where the people don't want to go, and where the costs of flying to Ottawa and giving testimony are prohibitive and all that.
For example, Speaker Milliken, committees can't move motions under the current agreement. How important is it that they maintain that same functionality virtually as opposed to in person?
move motions to what?
Well, to compel the government to provide documents, for example, there's all kinds of things that committees have been limited in doing.
Oh, and it was just done by changes in the rules of the House?
It was adopted by Parliament on 2 occasions now. Yeah.
I see. Oh, I was unaware of that. So, well, certainly the hearing witnesses, I don't think it's been restricted from what you've said.
No.
This is providing documents is another issue. And I'm surprised that's the case, but certainly the House could demand production of the documents, and then the committee can look at them with their heart's content. So it's a matter of dealing with that as a thing in the House in part, because certainly the House is able to make these demands. The committee could recommend to the House that the House demand production of documents, I suspect, and then if the committee reports concurred in, bango.
What about producing motions at committee?
Okay, that's all the time we have. I have given some leeway because we had some technical difficulties, but that's all we've got. Yes, it is true that in committee right now we cannot move motions. We have been requesting documents, and that hasn't been a problem from the witnesses so far, but I understand the other complications that could arise. And so we have one more questioner, and then after that, that's all the time we are going to have for this meeting today. And I will just have a couple of housekeeping items at the end. Mr. Turnbull.
Everybody, thank you, Madam Chair. Thank you all for being here today. I have 3 questions. I'm going to start with the one that I've been, puzzled with for quite some time. I think we often hear the term essential work or essential workers, and we're talking about frontline healthcare workers, grocery store clerks, construction workers, etc. All of these workers have a very physical element to performing their functional duties, and that I believe are essentially different than parliamentary functions and our roles. So in my briefing note, I'm a new member of Parliament, so excuse me if my understanding of my duties is simplistic. But what I've been told is that we're here to debate, legislate, take care of the business of supply, conduct committee work, and hold government to account. Now, I'm wondering from Mr. Tardy and Mr. Pelletier whether any of those functions or duties actually require us to be physically present in principle. Mr. Pelletier? You have to unmute yourself. There you go.
Yes. I don't see any function that requires the members of the parliament to be physically there, be physically present. It could be done virtually, though I would like to add to all the description that you just made that I consider that the House of Commons is also a public forum, which means that freedom of expression has to be exercised in public. And that is what is difficult to conciliate with virtual works for the House of Commons. Il y aura un défi, there's a challenge for everyone here to make sure that democracy is still alive, that the media still are able to cover the works of the House of Commons, and that the work, the House of Commons itself, stays as a public forum. Alors, à mon avis,
in my opinion, that's one of the great challenges that we have to deal with if we have to go more towards virtual sittings. Of course, the media has to still be able to offer quality coverage of the House and also the House, despite it being virtual, has to be also a public forum.
Made public and the media has access, then essentially there's no physical requirement. Mr. Tardy, do you want to respond to that as well? You're on mute. There you go. One more time.
You're on.
Mr. Tardy, you're on mute again. There you go.
Is it better now?
Yes.
Okay. I have an answer for you in three parts. First of all, with respect to the necessity for having a parliament and in particular House of Commons, I think the even more fundamental aspect of this is that democracy is in question. If there is no parliament, if there is no give and take, if there's no communication between the governors and the people, essentially, in my view, democracy breaks down. And that requires that there be a parliament, a viable legislative institution at all times. That's the first part of the question. The second, I think, is your point about the physical presence of members of parliament in almost, if you would say, facing each other. I have taken the view, and I want to reiterate now that what is much more important, I think, is a meeting of the minds.
Right.
Et là-dessus, je pense que je rejoins les pensées du professeur.
I'll get back to what Mr. Pelletier was saying.
On the same wavelength about this. And then finally, there's one point I've been trying to make in response to several members who have questioned this, and that is the temporal nature of whatever solution the House decides to adopt on these points. At some point, this pandemic will be over. In the worst case scenario, we can take the Spanish flu as an example. It lasted 2 years. That theoretically could bring us.
If we can have you wrap up your comments.
Absolutely, absolutely. That could bring us into 2022. At some point, the House will be able to resume its sittings in Ottawa with all MPs present. So with that, thank you.
Thank you. That wraps up our questioning for today's meeting. I just wanted to mention that our meeting on the 28th of April will also be a video conference meeting on the same Zoom platform. And there'll be 2 panels of witnesses. The first panel is for internet connection challenges and internet security. The second panel is video conferencing platforms that are available and feasibility. And we're still awaiting confirmation about our 3-hour request for a time slot. We were able to get accommodations made for the last several meetings, but we're still awaiting confirmation, I believe. And yeah, that's what the clerk is nodding to me as well about that. But my hopes are high that we will be able to get the same time slot that we've been having, which is, I see your hand, Mr. Richards, that we have, which is 11 to 2. Yes, Mr. Richards.
Yeah, just on that point, I guess my understanding is, if I'm not mistaken, the House, we're calling it, but essentially the question period would be occurring at I think it's noon Eastern on the same, so it would be overlapping with our meeting. I know there was already some discussion about the feasibility of this. Can you give us any update on how that would be handled in the I guess in the current, there's a conflict there, and what would that mean for the timing of our meeting?
Yeah, very, very good question, Mr. Richards. Just give me one moment, please. So I will further investigate as to with the different parties and their whips as to how this is being dealt with. But as far as me and the clerk and our team knows, is we are scheduled for 11. So it might be something you may want to bring up, Mr. Richards, but that is what's planned for now. If I get more information as to what talks are happening about that conflict, then I can share it via email with all of you. Seeing as no hands are raised at this time, that adjourns our 11th meeting of the Procedure and House Affairs Committee. Thank you everyone for participating today, especially our esteemed witnesses. Thank you.